Today we will have a short video presentation on depression, erectile dysfunction and antidepressants. In short, we can say that depression is the lack of joy of living, depressed mood, introversion, feeling depressed. Depression is a public health problem. It is a common disease. Depending on the severity of depression, in very severe conditions, it can lead to suicide. It can cause serious problems in business life, home life and social life. So are anxiety disorders. Patients with anxiety disorders may think that their relatives or themselves will die. These thoughts of death can often come to mind. Of course, these thoughts that come to the patient's mind frequently can prevent the patient from his normal life. It can disrupt his progress in his normal life. That's why psychiatrists can prescribe antidepressant drugs to patients when needed. Depression can cause erectile dysfunction in patients, depending on its severity, which might be about 50%. Anxiety disorders, which are frequently observed with depression, can also cause erectile dysfunction in patients. There is a group of drugs called antidepressants. Among them, especially SSRIs, namely selective serotonin reuptake inhibitors, can cause sexual dysfunction even if the patient didn't have erectile dysfunction in his depression. There is a possibility of sexual dysfunction around 60%. Here I want to briefly mention a scale. Here, we see the sexual disorders caused by antidepressants. Here, sertraline, namely Lustril, is the best seller on the market. We see venlafaxine in the second row, citalopram, i.e. Cital, in the third, paroxetine, i.e. Paxil, in the fourth, and Prozac in the fifth row. The substance in Prozac is fluoxetine. These are the most commonly used drugs in depression and anxiety disorders. Generally, patients use these drugs for years. They can use them for 5, 10, 15 years. When patients come to the clinic, there can be such a problem. The patient tells that he has erectile dysfunction, but when we deepen his history, we see that the patient has been using antidepressant drugs for years. When the patient stops taking the drug or takes a break, the patient's complaints may improve. If patients using antidepressants have these kinds of complaints, what I do is to send them back to the psychiatrist to tell about this problem, and the psychiatrist either changes the drug or pauses the drug or gives another drug along to increase sexual power. In conclusion, I have to say that depression and antidepressants can often cause sexual dysfunction. Therefore, it is necessary to be careful and be aware of this while using these drugs.